The Plague of Athens, which struck between 430 and 426 BCE, was one of the earliest recorded pandemics to profoundly alter the course of history. It erupted during the Peloponnesian War, when Athens and Sparta were locked in a bitter struggle for dominance over the Greek world. Pericles, the Athenian leader, had brought the population from surrounding rural areas inside the city walls for protection against Spartan invasions. While this strategy shielded them from enemy attacks, it created dangerously crowded and unsanitary conditions. The disease, whose exact nature remains debated, possibly typhus, typhoid fever, or an Ebola-like virus, spread rapidly through the crammed quarters. Contemporary historian Thucydides, who himself contracted and survived the illness, recorded the symptoms: sudden fever, inflammation, unquenchable thirst, and in many cases a swift decline that left the city's physicians powerless. The plague decimated Athens' military capacity and morale, killing a large portion of the population, including Pericles himself. With civic order breaking down, religious faith wavered, and lawlessness increased as many believed they would not live long enough to face consequences for their actions. The epidemic ultimately weakened Athens' strategic position, contributing to its eventual defeat by Sparta. More than just a medical disaster, the Plague of Athens revealed how war, urban density, and limited medical understanding could combine to amplify the impact of disease. It remains a case study in how pandemics can shape political and military outcomes, reminding later generations that, in times of conflict, the greatest threat to an army might not be the enemy across the battlefield, but the unseen contagion within its own walls. The Antonine Plague, which ravaged the Roman Empire from 165 to 180 CE, was one of antiquity's deadliest pandemics and a turning point in imperial history. Likely caused by smallpox, though some scholars suggest measles, it began when Roman legions returned from campaigns in the Near East, unknowingly carrying the pathogen with them. As soldiers moved along the empire's vast road network, the disease spread rapidly through cities and military outposts, striking both the wealthy and the poor. Ancient accounts, including those by the physician Galen, describe high fevers, skin eruptions, and severe gastrointestinal distress. At its peak, the plague is believed to have killed millions, with estimates suggesting as many as 2,000 deaths per day in Rome itself. The loss of manpower hit the military especially hard, weakening frontier defenses and forcing the empire to recruit less experienced soldiers. Civil society also suffered. Agricultural output dropped, trade slowed, and tax revenues shrank, straining imperial finances. The co-emperor Lucius Verus succumbed to the illness, and while Marcus Aurelius survived, the burden of ruling during such a crisis weighed heavily on him. The pandemic's psychological impact was just as severe, shaking the sense of invincibility that had characterized Rome's golden age. Temples were filled with supplicants seeking divine intervention, yet the disease continued to ravage communities regardless of faith or status. The Antonine Plague stands as an early example of how a microscopic invader could humble the world's most powerful empire, undermining its military, economy, and morale, and foreshadowing the vulnerabilities that would plague Rome in the centuries to come. The Plague of Justinian, which struck the Byzantine Empire beginning in 541 CE, was one of history's first recorded bubonic plague pandemics, and a catastrophe that nearly crippled the Eastern Roman world. Named after Emperor Justinian I, who was in the midst of ambitious campaigns to restore Rome's former territories, the outbreak began in the empire's bustling port cities, likely arriving via grain shipments from Egypt infested with plague-carrying fleas. Constantinople, the imperial capital, was especially vulnerable due to its dense population and role as a major trade hub. Contemporary historian Procopius described harrowing scenes, corpses piling in streets, mass graves overflowing, and officials struggling to maintain order. Symptoms included fever, delirium, and painful swelling of lymph nodes, hallmarks of the Yersinia pestis bacterium. At its peak, the plague is estimated to have killed thousands per day in Constantinople alone, wiping out as much as 40% of the city's population. The toll across the empire may have reached tens of millions. The economic impact was severe. Farmland went untended, armies were depleted, and tax revenues collapsed.
Even Justinian himself contracted the disease, but managed to recover, though his empire never fully regained its prior strength. The plague recurred in waves for more than 2 centuries, further eroding Byzantine stability and contributing to the empire's inability to maintain control over its vast territories. Beyond its immediate devastation, the Plague of Justinian demonstrated how interconnected trade routes could turn local outbreaks into empire-wide disasters, foreshadowing the later pandemics that would sweep across continents in the centuries to follow.
The Black Death of 1347 to 1351 was one of the most catastrophic pandemics in human history, killing tens of millions and reshaping societies across Europe, Asia, and North Africa. Caused by the Yersinia pestis bacterium, the plague traveled along trade routes from Central Asia, likely carried by fleas on rats aboard merchant ships. It first struck ports in the Mediterranean, then spread inland with terrifying speed. Victims often developed sudden fevers, chills, and painful swellings, buboes, followed by dark blotches on the skin, giving the disease its grim name. In many cases, death followed within days. Cities became centers of panic as populations were cut in half, and rural areas fared little better, with entire villages abandoned. With the workforce decimated, agriculture and trade collapsed, leading to severe economic disruption. The plague also shook the foundations of religious and political authority. Traditional explanations failed, and fear drove some to scapegoat marginalized groups, resulting in tragic acts of persecution. Art and literature of the era reflected the pervasive awareness of mortality, and labor shortages empowered surviving workers to demand better wages and conditions, subtly altering the feudal structure of Europe. The Black Death's mortality rate was so high that it left demographic scars for generations, and recurring outbreaks for centuries ensured its place in collective memory. More than a public health disaster, it was a social, economic, and cultural turning point, proof that even the mightiest kingdoms could be brought to their knees by an invisible enemy. The Cocoliztli epidemics of 1545 to 1576 were among the deadliest outbreaks in the history of the Americas, devastating the indigenous populations of Mexico during the early colonial period. The term Cocoliztli, meaning pest or plague in Nahuatl, described a mysterious and highly lethal illness that struck in 2 major waves, each killing millions. Spanish chroniclers and indigenous records describe symptoms including high fever, severe headache, intense abdominal pain, bleeding from the eyes, nose, and mouth, and rapid dehydration. Victims often succumbed within days. While the exact cause remains debated, modern research suggests a hemorrhagic fever, possibly exacerbated by extreme drought conditions, malnutrition, and the social upheaval following Spanish conquest. The epidemic spread rapidly through densely populated farming regions, where the newly imposed colonial system had forced indigenous communities into close quarters for labor and tribute. Mortality rates were staggering. Some estimates suggest that up to 80% of affected populations perished. These losses compounded the demographic collapse that had already begun after European contact due to smallpox and other Old World diseases. The Cocoliztli outbreaks not only shattered indigenous societies, but also reshaped the cultural and political landscape of Mexico. With entire villages wiped out, Spanish settlers were able to consolidate land and labor more easily, accelerating the colonial transformation of the region. The epidemics stand as a stark reminder of how pandemics can intertwine with conquest, environmental stress, and social disruption to create a perfect storm of devastation, altering the course of history for generations to come. The Great Plague of London in 1665 to 1666 was the last major outbreak of bubonic plague in England and a grim chapter in the city's history. Part of the wider second pandemic that had plagued Europe since the 14th century, it struck a metropolis already struggling with overcrowding, poor sanitation, and poverty. The disease arrived silently in the spring of 1665, likely brought by fleas on rats carried in by trade ships. As the hot summer months set in, the infection spread rapidly through the city's narrow, filthy streets. Symptoms included fever, vomiting, delirium, and the swollen lymph nodes, or buboes, that gave the disease its name. With no effective treatment, mortality soared. At its peak, Thousands were dying each week. Wealthier citizens, including King Charles II and his court, fled to the countryside, leaving the poor trapped in quarantine neighborhoods marked with painted red crosses and the words, "Lord, have mercy upon us." Public services collapsed, commerce slowed to a crawl, and fear gripped the city. By the time the outbreak subsided in 1666, an estimated 100,000 people, roughly a quarter of London's population, had perished. The disaster was followed almost immediately by the Great Fire of London, which, while devastating in its own right, helped destroy much of the rat-infested housing that had fueled the spread. The Great Plague of London stands as a vivid example of how urban density, inadequate sanitation, and limited medical knowledge could transform a localized outbreak into a catastrophe, leaving a lasting imprint on the city's memory and infrastructure.
The third cholera pandemic, lasting from 1846 to 1860, was the deadliest of the 7 cholera pandemics and marked a turning point in the understanding of infectious disease. Originating in the Ganges Delta of India, the outbreak spread along global trade and military routes, reaching Asia, Europe, North America, and Africa. Cholera's symptoms, sudden onset of severe diarrhea, vomiting, and rapid dehydration, could kill within hours if untreated, and the disease's rapid spread terrified populations. Cities like London and Paris, with their crowded neighborhoods and poor sanitation, became epicenters of devastation. Mortality was staggering. In Russia alone, more than 1 million lives were lost. It was during this pandemic that British physician John Snow made his groundbreaking discovery linking cholera transmission to contaminated water. His famous investigation of the 1854 Broad Street outbreak in London, in which he identified a single contaminated water pump as the source, laid the foundation for modern epidemiology and public health. Snow's work challenged the prevailing miasma theory, which held that diseases were caused by bad air, and spurred the development of better sewage and water systems in many cities. Despite these advances, the pandemic exposed the inequalities of the industrial age, as the poor, living in overcrowded and unsanitary conditions, bore the brunt of the impact. The third cholera pandemic not only claimed millions of lives, but also reshaped urban planning, proving that combating disease required as much attention to infrastructure and social reform as to medicine.
The Russian flu of 1889-1890 was the first pandemic to unfold in an age of modern communication and rapid transportation, allowing it to spread with unprecedented speed. Believed to have originated in Central Asia or Siberia, the disease, likely caused by an influenza virus, though some modern scientists speculate it may have been a coronavirus, made its way westward via expanding railway networks. The first major outbreak was recorded in St. Petersburg in late 1889, and within weeks it had reached the capitals of Europe. Transatlantic steamships carried it to North America, and soon the illness was circulating worldwide. The Russian flu struck in waves with symptoms including fever, fatigue, muscle aches, and severe respiratory distress. While mortality rates were lower than in some historic pandemics, the sheer scale of infection was staggering, affecting people across all social classes. Major cities saw daily life grind to a halt as businesses, schools, and even government offices closed due to high absenteeism. The rapid global spread shocked public health officials and underscored how interconnected the world had become. Newspapers provided daily updates, and the telegraph carried reports across continents, creating a shared sense of urgency and awareness that was new for a pandemic. The outbreak subsided in 1890, but returned in milder waves in subsequent years. The Russian flu demonstrated how advances in transportation and communication, while linking the world, also created new vulnerabilities to global disease spread, a lesson that would echo in the pandemics of the 20th and 21st centuries.
The Spanish flu of 1918 to 1919 was one of the deadliest pandemics in recorded history, infecting an estimated 1/3 of the global population and claiming tens of millions of lives in just over a year.
caused by an H1N1 influenza virus. It emerged during the final months of World War I, when troop movements and crowded military camps created ideal conditions for rapid spread. The first wave in early 1918 was relatively mild, but the second wave, beginning in the autumn, was far more lethal. Unusually, it struck hardest among young, healthy adults, a pattern that defied typical influenza outbreaks and overwhelmed medical systems worldwide. Symptoms often began with high fever and severe fatigue, but in severe cases, the virus caused rapid pneumonia, turning the skin blue from oxygen deprivation and leading to swift collapse. Cities imposed quarantines, closed schools and theaters, and mandated masks, yet the virus spread relentlessly. Misinformation was rampant. Wartime censorship and many countries downplayed the severity to maintain morale, which is why the disease came to be called the Spanish flu. Spain, neutral in the war, reported openly on its impact. In the U.S., Philadelphia's decision to hold a massive parade in the midst of the outbreak became a cautionary tale after the city's hospitals filled beyond capacity within days. By mid-1919, the pandemic had largely subsided, leaving behind not only a staggering death toll, but also a legacy of public health reforms and awareness about the need for coordinated global responses to disease. The Spanish flu forever altered how nations prepared for and responded to pandemics.
The Asian flu of 1957 to 1958 was the first major influenza pandemic of the modern post-war era, caused by the H2N2 strain of the influenza A virus. It originated in East Asia, most likely in southern China, in early 1957 before spreading rapidly through Hong Kong, then across the globe via air travel and shipping routes. Schools, military bases, and urban centers became key hotspots as the virus moved swiftly through populations with no prior immunity. Symptoms were typical of influenza: fever, sore throat, cough, and fatigue, but the scale of infection placed immense pressure on hospitals, especially during peak waves. In the United States alone, hundreds of thousands were hospitalized and an estimated 70,000 people lost their lives. Globally, the toll was in the millions. What distinguished the Asian flu from earlier pandemics was the speed of scientific response. The virus was identified within weeks of its emergence, and mass vaccine production began soon after, marking one of the first large-scale uses of a pandemic vaccine. While the vaccine helped curb the second wave in 1958, the outbreak still revealed weaknesses in preparedness, particularly in coordinating public health messaging and distributing medical supplies. The pandemic also highlighted how modern transportation could spread a disease worldwide in a matter of months, erasing the geographic buffers that had once slowed earlier outbreaks. Though often overshadowed by the more famous 1918 Spanish flu and the later 1968 Hong Kong flu, the Asian flu was a crucial turning point in global health, showing that rapid scientific action could save lives, but also that global interconnectedness came with serious epidemiological risks.
The HIV/AIDS pandemic, first recognized in 1981, has become one of the longest-running and most consequential global health crises in modern history. Initially identified among clusters of young men in the United States presenting with rare infections and cancers, the illness was soon linked to the human immunodeficiency virus, HIV, which attacks the immune system, leaving individuals vulnerable to opportunistic diseases. Early in the pandemic, fear and stigma were rampant, fueled by misconceptions about transmission and the fact that the disease disproportionately affected marginalized groups, including gay men, intravenous drug users, and communities in sub-Saharan Africa. The virus spreads primarily through unprotected sexual contact, contaminated needles, and from mother to child during birth or breastfeeding. By the mid-1980s, HIV/AIDS had reached every continent, with millions infected and no cure in sight. Governments and health organizations struggled to mount effective responses, and in many places the crisis was met with silence or denial. The development of antiretroviral therapy, ART, in the mid-1990s transformed HIV from a near-certain fatal diagnosis into a manageable chronic condition for those with access to treatment, drastically reducing AIDS-related deaths. Yet inequalities in access meant the pandemic continued to devastate regions with limited healthcare infrastructure. Today, prevention strategies, including education, safe practices, and pre-exposure prophylaxis, PrEP, have significantly slowed transmission in some areas, though the virus still affects millions worldwide. Beyond its medical impact, the HIV/AIDS pandemic reshaped public health policy, inspired activism, and forced societies to confront issues of stigma, inequality, and the global nature of disease. The COVID-19 pandemic, which began in late 2019, quickly became the most disruptive global health crisis of the 21st century. Caused by the novel coronavirus SARS-CoV-2, it was first detected in Wuhan, China, and spread rapidly for international travel and human-to-human transmission. Within weeks, cases were reported on every continent except Antarctica. COVID-19 symptoms ranged from mild fever and cough to severe respiratory distress, with certain groups, particularly older adults and those with underlying health conditions, at far higher risk for serious illness. In March 2020, the World Health Organization declared it a pandemic, prompting unprecedented global shutdowns. Borders closed, economies slowed to a crawl, and billions of people experienced lockdowns, social distancing, and mask mandates. Hospitals in many regions were overwhelmed during peak waves, and supply shortages, from ventilators to basic protective equipment, added to the crisis. Scientific response was swift. Within a year, multiple vaccines were developed, tested, and deployed, an achievement without precedent in medical history. Yet, uneven distribution and vaccine hesitancy meant the virus continued to spread, evolving into new variants that sparked additional surges. The pandemic's toll extended beyond health. Education systems, supply chains, and social norms were profoundly disrupted, while misinformation campaigns fueled division and distrust. By 2023, many countries had eased restrictions, but the virus remained present, transitioning toward an endemic phase. COVID-19 reshaped global health policy, accelerated remote work and digital infrastructure, and underscored the fragility and interdependence of modern society. It will be remembered not only for its staggering human cost, but also for the speed and complexity of the world's scientific, political, and social response.